Okay, good morning. Welcome to the Cowlitz County Board of Health meeting. We're going to start this meeting at 10 o'clock. I'd like to say that a lot of people have been sick, my family as well, and I'd just like to show this old graphic here. Wash your hands. It's one of the most important things. I don't know if you can see it up there, but it's one of the most important things to do and easiest things to do. Wash your hands. And I'd just like to say too, if you're feeling sick, stay home. So with that, we'll move on. First order of business would be to review the minutes. I'd like to entertain a motion to accept the minutes. Everybody get a copy? Any changes or any discussion about it? No? Somebody like to accept them?
Move to approve.
Motion to approve the minutes is on the floor. All in favor, say aye.
Aye.
Any opposed? Okay, that motion passes. Okay, next thing we've got is our HHS and our health officers got a quarterly presentation for us. They're going to give us some information on, well, I've heard a few things. So I'm going to turn this over to Dr. Krager and to Gina.
Thank you. Good morning.
Good
Gina
morning.
James, Health and Human Services. I'm just setting out a couple extra copies here for the public if they would like to follow along. We do have some slides that it will be shown on the screen, and you have copies as well in front of you. So we wanted to share the first item. So I have Dr. Krager here with me as
Thanks,
well, our
Gina.
health officer. So we're going to talk, I'm going to talk through a couple of the slides. Dr. Krager's going to finish off with some additional information. So we first wanted to share our 2024, some of our 2024 numbers with you. So in the slide is just kind of a snippet of it, and you have a full handout and the last page of what I provided for you. So we just wanted to share our numbers from 2024 in some of our program areas that we're involved in, our different food establishment inspections that we have to do, water rec, septic systems, all the different areas of work that we're involved in. Just some information for you to get an idea of the frequency and what that looks like for us. We're also sharing we have vital records that we're involved in. So you'll see the number of death records processed and birth and death certificates issued, over 8,800, which is quite a lot. So that's a good chunk of what we do. And then at the bottom, we also have what are our top 10 notifiable conditions that were reported in, and this is for 2023. That particular data is a little bit lagged, so we won't have 2024 final data until about April. So what we have here is final from 2023. So it just shows what our top 10 notifiable conditions were for that year in terms of what was reported to the health department.
Question,
Yes.
what initiates a test for rabies?
So typically what happens is we get a phone call from someone in the community who says, we found a bat. My cat showed up on the porch with a bat. And so then we kind of talk through what that looks like. Did they have it in their mouth? We'll kind of assess first a risk to human exposure. If there's a risk to human exposure, we want to know that right away and help get them connected to treatment. So we'll have our nurses talk to them to determine that piece. If there's no risk for human exposure, we will talk about what the animal's risk is. We are able to send the bat itself to the public health lab to be tested so we can find out if the bat does have rabies or not. We can also give some guidance to the individual in terms of their animal about, have they been vaccinated for rabies? are they due for that, and kind of help them figure out what their next steps are for their animal if they think there was a risk of exposure to the animal. So most of the time it comes in as a phone call from individuals.
Okay.
So I just have a follow-up question on that. How many tested positive?
So most often they don't, which is great. We don't want we don't want rabies going around. So most often it's negative, but we have had positive. We've had some positive. Yeah, every now and then.
Gina, as far as the shared well water system inspections,
hmm
we had 2.
hmm
I'm trying to see, my eyes are just horrible. It says with what?
All right, so those are Group B systems with 3 to 14 connections. So with those particular systems, so if there's 3 to 14 connections to that well, we permit those, but we're not required to do an inspection, like an annual inspection, for example. There's some water testing requirements that happen. We typically do an inspection if there were issues with the test results, then we might go on site and help them, help the owners problem solve and help them come up with next steps and what they can do.
Are these new wells or established?
Mostly established. We might do an inspection. Also, if there's a new well being put in and developed, that would be another scenario where we would do an inspection.
Do you have purview over private wells into like individual homes?
Private wells, yes, but not the construction. The construction lies with Department of Ecology. So we'll do what's called a utility verification. It's to demonstrate that there's potable water available on a parcel. So that's sort of our role in that, with individual wells. And then the construction of the well itself, the Department of Ecology oversees that.
So in this case, in these 2, did they call you and say, hey, we want you to come and check this out?
I'd have to look at the 2 in particular, but it would most likely be that test result came back where the testing was off, and we might, in communicating that with the homeowner, we would offer to come on site and help look at. We would retest again. Sometimes you test again, and then it falls within the normal range, which is great. Other times it's trying to pinpoint, okay, where was the water collected when we did the test? Let's test from other sources and to try to figure out if it's something that might be at the wellhead itself or farther up closer to the house, or that kind of thing. So just going on site and kind of working through some of that.
Well, the only reason I ask is, and there may be no correlation here, so please help me out. With all the talk about arsenic, only 2? I mean, so was it really? I'm just surprised.
Yeah. So, and
2.
yeah. And so, like I said, those are just the Group B systems where there's 3 to 14 connections. So that's not individual wells. And good news is we don't see arsenic testing positive in those very often. So
Is the connection in this case 3 to 14, is that basically 3 to 14 houses? Or is a irrigation connection counted as something like that?
it's most often a neighborhood that's sharing a single well is most often what it is,
Okay.
3 to 14. Mhm. Yeah. Any other questions on that, on the numbers, by the numbers?
Now we get to the good stuff.
The good stuff. So we thought we'd also just kind of dive in a little bit on food establishment inspection. So we just kind of picked one of our program areas just to share a little bit more information with the Board of Health. So I have a couple pictures just to show. I do have some good ones too. So just some of the.
In Clark County, right?
Yeah. Yes, I will not be disclosing where this was, but so these are some of the things that we occasionally find when we go out and do restaurant inspections. I want to emphasize that occasionally. So in this particular case, this was sort of like an extra storage room. And so when we went and did the inspection, we found a deceased rodent and, and evidence that he may have been hungry before he passed. So these are some of the things we're looking for when we go and do inspections, is we're doing this sort of check of the facility. So we occasionally find these things. On the next slide, something similar, maybe a little bit more technical. So, this was a pan of refried beans that had started to grow some mold. So we had discovered that when looking through the refrigerator. So that, of course, would be, in a lot of these cases, we try to correct in the moment. And, that obviously gets tossed, so we can see it get tossed. So we know it's not going to be served to anybody. And the picture on the right-hand side was, somebody storing a bottle of juice in the ice machine that's used to get ice for some drinks and what have you. So just making sure that comes out, that the ice gets discarded and kind of starts over. So those are some of the things that we look for when we're doing inspections, along with a whole slew of, other requirements. And as I mentioned, a lot of times we'll just work with them to correct things in the moment and provide some education and moving forward about what to do with those things. So on the next slide, I did want to share, most often we do not find those yucky things. We most often, we do walk in and find some beautiful facilities where everything is neat and clean and orderly, and that's really going to create the best environment for cooking foods, so that they won't make people sick. So I wanted to make sure to show that as well, so we don't all leave afraid of eating at restaurants. Next slide, just to talk a little bit about what the process looks like for our food establishments. They are inspected anywhere between 1 and 4 times a year. Most are around 1 to 2. And how we determine that is based on our inspection history. So if we do an inspection and we find, repeat violations when we do those, we will bump them up in inspection frequency. So that's kind of how we base it off of. If we do inspections then and we get several that come back, really amazing, then we might move them back down to less frequent inspections. So we are always kind of looking at that and adjusting that frequency based on what we see when we go on site.
How many warnings will a restaurant receive?
Well, the inspection report is a point-based system, and it's kind of split into 2 categories. There's blue points and there's red points. And as you might assume, blue is kind of the lower risk. What's the right word? Lower risk, not like citations, but findings. And red would be the higher risk, like issues with heating, cooling, or meat draining down to your vegetable, that kind of thing, the higher risk items. So there's a point-based system. If they hit certain points, then we do follow-ups. So then we'll ask to correct things in the moment. If we can't, if they can't correct in the moment, we'll come back and do a follow-up and to verify that corrections have been made. If we still see some issues, we'll ask for like an office conference where we have management come in and talk through hey, this is what we found. This is, let's work on getting these things back up to healthy standards, and we go from there. So we rarely get to the point where we are looking at closing a facility, and we always want to do that education and work with restaurants. But of course, our primary goal is making sure it's safe for people to eat, but we do as much as we can with correcting in the field and educating and working with restaurants so that we don't have to go down that route if we don't need to. So
How many inspectors do you have, Gina? Just out of curiosity.
we have 4. for right now.
Covering all the restaurants in Calhoun County?
Yeah, so there's over 600 food establishments, and we, at any given year, have 200 to 300 temporary permits that are applied for as well. Yeah, it's a lot. It's a good chunk of the work that we do. Yeah,
There's 600 food establishments in Calhoun County.
hmm it's a lot, right? I mean, and it counts. So when I say food establishments, we're talking about restaurants. We're also talking about coffee stands. We're also talking about like a Safeway, grocery stores, things like that. So anywhere that food trucks,
Food trucks, all that kind of.
Mhm.
Deli bars, all of that.
yeah, gas stations, all of those types of facilities that are serving food. Yep. Did you have a question, Larry?
Yeah. What is the training for your food inspectors?
Yeah.
And do they have to have retraining? How do you handle that?
Yes, it is a pretty intensive training process. The state helps put together a lot of training materials, and then they're required to do so many inspections through observation. So they will observe inspections first, and then they're observed doing inspections as well before they're sort of released to be on their own to do inspections. So it's a pretty intensive training process, and there's always that continued education going on as well if there's changes with the food code and things like that.
Okay, another question. We got an awful lot of people now delivering food. So you inspect the restaurant, everything's fine. Some guy shows up and picks it up and then takes it to somebody.
Yeah.
How do we make sure that process is safe?
I mean, that's a great question. We don't have oversight of how that happens. If, something happens in that transit, we respond to complaints. And so if someone gets food delivered and they eat it and become ill, they might call us and say, hey, I had food from this place and now I'm sick. And we'll take that information and do like a foodborne illness investigation is what it's called, where we'll talk with them about what they've eaten the last like 72 hours, what that looks like. If we get multiple complaints that tie back to the same restaurant, then we know we have something going on and then we'll be going and kind of trying to figure out what that might be.
Yep. Okay, thank you.
So under food establishments, what about catering? Ones that are cater food, is there anything special for them?
Yes, there is a catering permit where we'll review what their plans are for transporting food and keeping it at the appropriate temperatures. So they do have to have a catering permit if they're going to be taking their food out of and serving it at a different location.
So would that fall into the numbers there of food establishments, or catering would be a different metric somewhere else?
I think it might fall under temporary, no, under the annual stuff. Yeah, so it's not necessarily a separate food establishment, but it's a separate type of permit.
Okay, so not included in your metrics here.
No.
Okay, so the other part is, just following up on some metrics, 645 inspections last year. You said 600 establishments, 4 inspectors. That's just barely covering 1 per food establishment.
Mhm.
So our metrics don't quite line up with 1 to
Sure.
4.
Yeah, and let me clarify. So we fully staffed is 4 inspectors. We had some turnover last year. So we had most of the year where we only had 2 inspectors. So we're back fully staffed now this year. And so what we ended up doing last year was prioritizing the higher risk establishments and making sure we did those inspections. So yes, you're right. The numbers are a little bit skewed for last year because of that.
Great questions.
Mm-hmm.
Does this include schools?
Yes, it does.
What constitutes a higher risk establishment?
So if we would look at their menu, and sometimes the size of the restaurant too. So if their menu is where they're preparing a lot of raw foods, for example, that's considered higher risk. And then also if their restaurant's able to serve a large number of people, right? And we have a lot of people coming in to consume that food, so they would be considered a higher risk. They would also maybe be considered higher risk based on their history, their inspection history as well. Yeah.
So these same 4 inspectors cover how many different categories on this list? They cover the food establishments and the temporary food vendors.
Yes.
And basically, is that their expertise? They're not doing water testing or?
So it's primarily food is a large portion of their workload, but they're also involved in the rabies piece with animals, as well as water rec inspections. So that's with your pools, spas, things like that, and the Group B water systems as well. So they are involved in those pieces. It's a smaller part of their workload. The food is the larger part, but it is part of what they do as well.
Okay.
Yeah. And one exciting thing that we're happy to have available now, we have inspection reports available online. So you can look up a restaurant and view the last inspection report and see how it was. So we have that. We had it online a few years back, and then our data system crashed. And so we now are back up and have it available online. So you can find it on our website. You can look for that button there and it will take you right to it, and you can search by the restaurant name. And we hope to eventually, Carol's dream is to have a map then that you could, would pull up a map of Cowlitz County and you could just click right on the different restaurants and be able to see their inspection report. So someday.
So Gina, along those lines, am I understanding you to say that you have a list of restaurants you personally wouldn't eat at? And if so,
Yeah, I would encourage you to look at the inspection reports. You can make your own decision about where you'd like to eat. No, I think we're really fortunate. We do have a lot of great restaurants. We have good, good relationships with those restaurants, and and there's a lot of tasty food out there. So
Gina, I just want to make sure I'm reading this correctly. This is your quarterly update, but these numbers are for the whole year of 2024.
yes.
Okay.
Yes.
Got it.
Yeah. So, and then Dr. Krager's just going to talk a little bit more about the why.
Yeah, exactly. So, good morning. Yes, as Gina mentioned, why do we do this work? I'm going to just touch on this very briefly because I could talk about this for hours. But these are kind of the common bugs that we see in foodborne illness, sometimes waterborne, but mostly food. Some of them you've probably heard of, some of them you may not. I want to just go over them briefly, kind of what temperatures they grow at most optimally, what foods they're associated with, and we'll talk a little bit about symptoms, but most of these we're going to talk about are gastrointestinal symptoms, right? So vomiting, diarrhea, sometimes fever, that sort of thing. Salmonella, one of the most common. I'm going to go more in depth on the more common ones and then just barely touch on some of the less common ones. So really can grow at a range of temperatures, but really that optimal temperature 95 to 109. So if you're in that really warm place, not a good place for Salmonella. It can be in a lot of different things. We do see it in raw eggs, but also other like poultry and meat, unpasteurized milk sometimes, and sprouts have been implicated. Sometimes other produce as well. Infectious dose. So this is like how much you need of the bacteria. So how many cells you need of the bacteria in order to get infected. It can be as low as 15 to 20, which is not very many. We're talking about when you're infected with something like this, millions or billions of E. coli cells. So you don't need a lot to get infected. One thing with foodborne illness that I think is interesting that sometimes people aren't as clear on is how long it takes to get sick. So a lot of times people will be like, oh, I just ate this meal and then I got sick a couple hours later. It was probably this meal that got me sick. And usually that's actually not the case. Most of the time, it's usually like a day or two before that we're talking about. This makes things challenging, right, from an investigation perspective, because we're often talking, going back even a week sometimes of what you ate. People's memory is not great. I don't remember what I ate, 5 days ago. And so trying to narrow that down, sometimes, it's helpful with a restaurant. People will remember that experience. But it really often takes multiple reports to link it to something. And I will say a lot of times we're just not able to figure out what the cause was. So it might be a restaurant, it might be home. Sometimes we're just not able to tell. And a lot of these obviously can also be passed from person to person, which is another reason why we're involved. So that can make things a little bit complicated as well. So E. coli, there's a subtype called O157H7. I bring that up because it's kind of the most dangerous subtype. So again, kind of the similar kind of temperature as Salmonella, really around 98 degrees. We're talking like that's human body temperature, right? Grows really well. So undercooked ground beef, raw milk, contaminated produce, these are the things we see it most with. Again, not very many organisms we need. And O157 specifically can cause something called hemolytic uremic syndrome, which is a dangerous kind of kidney complication. It can kind of shut your kidneys down. That's probably the most common. It doesn't the most common reason for like severe illness that might cause someone to be hospitalized with E. coli, and sometimes can lead to death. So that's one that really gets my radar up. If we're seeing that, we really want to track that down. It's really, especially like more vulnerable populations, kids. We've seen some really bad outcomes in kids sometimes that get that type of E. coli. Not specifically in Cowlitz County, but in other places. Okay, so other bacterial. So I'm going to go through bacterial, virus, and then one parasite, and then I'll be done. So listeria, you may have heard of that, especially dangerous for pregnant women. It's some of the reasons why we avoid like certain cheeses, certain meats, deli meats in pregnant women. Campylobacter, you will see on the list because it's pretty common, often linked with contaminated water or produce. That's another one that we often really struggle. We get a decent number of reports, but often really struggle to figure out exactly where it came from. Shigella is another one, can cause bloody diarrhea. E. coli and Salmonella can cause bloody diarrhea as well. I bring it up because if that's happening, great reason to get tested at a doctor. A lot of these, for most healthy people, you're going to be okay. It's not going to be fun, but you're going to have a couple days of symptoms or a few days of symptoms. As long as you're staying hydrated and resting, you're going to be okay. Bloody diarrhea, it can be a little bit more complicated. And just from a public health standpoint, we want to know because it's often more linked to a more dangerous pathogen. So if we're talking about like straight food poisoning, what I go to is Staphylococcus aureus. So this can cause skin infections, but it can also be associated with food. It creates a toxin, and this is one of the few ones, thankfully it's not very common, where you actually will get sick within like a half an hour to an hour after eating. And that's because you're getting the toxin that's making you sick instead of a bacteria or a virus that has to like grow in your body for a while before you get sick. So viral, I'm going to harp on norovirus a little bit. I've known personally people who've gotten sick with norovirus recently, and in another county that I work for, I've seen some outbreaks in like long-term care facilities. Another one, a viral particle is much, much smaller than like a bacteria. And again, just a really low infectious dose. Usually takes about 1 to 2 days after you're exposed to get sick. Really contagious. Sometimes we'll see it in a classroom, right, with school kids, and it'll just kind of blow through everyone in 3 to 4 days. Here's the biggest thing with norovirus. Alcohol sanitizers don't work. you have to wash your hands with soap and water. If you're talking about noroviruses, anyone has like a gastrointestinal illness, I recommend, and you're caring for them or around them or yourself, just washing your hands with soap and water instead of using hand sanitizer, especially just in case it's norovirus, which is probably one of the most common reasons that we see kind of a foodborne illness. Norovirus can be associated with food, but probably more often it's person to person, which unfortunately sometimes can happen from like a food handler, right, who's sick. Hepatitis A, we don't see a ton, thankfully, but also can be from contaminated food and water. Really long, so incubation is how long it takes for you to get sick, 15 to 50 days. So that one's a little bit harder. And certain higher risk groups, we do recommend get vaccinated for hepatitis A. Let's see, last one, Toxoplasma gondii. That is a parasite sometimes most associated with undercooked pork. I thought I put pork on there, but, and then, yeah, higher risk for pregnant women and immunocompromised adults. So those are again, the reasons why we do this work. I want to also just shout out our food inspectors who do an amazing job with a sometimes challenging work, right? Not everyone loves to see the food inspector come. But I will say, I think our food inspectors do a great job of, again, approaching things from an educational standpoint. We're there to help. We're not trying to harm you. We just want to make sure people are safe. And that's all I got today.
Good morning. Thank you. My question for you, what is the reporting system that we have got so that all of a sudden you or somebody comes out and say, hey, we got a problem with this particular thing? How does a particular personal instances
Yeah.
somehow get back to a reporting system so we know we got a problem?
Great question. So this is true of several kind of infectious diseases. We call them notifiable conditions, and a lot of those foodborne illnesses that I talked about are notifiable conditions. That means that if a hospital or a clinic tests someone with a lab test and it comes back positive, that lab gets reported to the state, and then it usually funnels down to us, or sometimes it's the other way where it gets reported to us and then we report it to the state system. Some of that is electronically. Sometimes places will still fax. So we do ask, a lab will often send it to us. Sometimes providers will also send it to us. We do ask healthcare providers, doctors, nurse practitioners, if they have one of those notifiable conditions, to send it to us. I think to me, it's an important part of our public health system, why we're here. One doctor may see an E. coli case, but then the next case will go to a different one. And without us kind of having that link, we wouldn't know and make that connection. So it's a great question.
I might add that the notifiable conditions, that is available on websites, and it will list all of the notifiable conditions, so that if you go to a healthcare provider and they diagnose one of those, they have to notify by law.
Yes.
If I could, I'd like to go back to the shared water systems again. So for the shared water systems, for an inspection, is a water testing report required?
There is testing, water testing. So for these Group B systems, there's testing required annually, and there's testing required once every 3 years. And I always get them mixed up if it's bacteria or coliform. But there is testing that's required to be done on those systems and submitted. So
Okay, so the second question is, when I look at the testing lab report, it's got 36 of attributes on there. Arsenic is one and others, but we don't know, as just normal citizens, which one of those need to be checked for going to a lab to test for satisfying your results or for the health aspects. Where do I get that information?
we're happy to sit down and talk with you about that. For the Group B systems, we do recommend certain pieces be tested, and we help with that. So we have like testing bottles, and we help facilitate that piece of it. And we do, ask that certain pieces be tested. But we're happy to have a conversation with you about that and what might be most helpful for you.
Okay, and do you, now, all of the public water systems, also, I can go to any one of those and they'll show what their results were for last year. So that's an average over time. So if there is a deficiency along the way, do you get involved, or is that basically the cities or whatever the public water system is?
Yeah, if you're talking about the larger systems, that the state works with those systems directly.
They do, okay.
Yeah.
Okay, thank you.
Well, thank you very much for the presentation. It's a little yucky and very interesting, but it's quite important, I think.
Yes.
Big part of the job for HHS and the Board of Health.
Yeah.
Thank you.
Yes, thank you.
Thank you. Okay. I'd like to move on to, at the last meeting, we discussed a youth substance abuse prevention project. And to refresh everybody's memory, we've got a short video Kelly can put on the screen for us. It's only a minute and 10 seconds or so.
Straight Up uses its improv troupe to reenact scenarios that take place every weekend at parties across the country. These reality parties are designed to educate parents about the dangers of mixing kids with alcohol.
Each of the vignettes hit a completely different aspect of the party. Peer pressure, daring each other, I won't like you if you don't do this, and seeing them cave under that, that's just heart-wrenching.
One of the things that happened also in the evening was that they had the cops coming in. Someone had called them and had indicated to the owner that she was now going to be charged because she was allowing underage drinking, and that she could get up to a $2,500 fine, which that was great. I'm thrilled to death to hear that there's that kind of thing out there that parents can call.
In the fight to prevent underage drinking and the problems associated with it, educating parents is just the first step.
We need to change what parents think is acceptable, and I think it's very important to warn parents about it and tell them that they should not be throwing these type of parties, allowing kids to drink, thinking it's okay to give drinks to other people's kids.
Straight Up Ventura County also reaches out to youth in the community through workshops and discussions that address their concerns about underage drinking. For Time Warner SoCal News, I'm Kathy Harton.
That's a very old video, but that's the idea in a nutshell. It is for parents. It is a play that is performed for the parents. Everybody I've talked to, with one small exception, has been very positive about this. And I'd like to just clarify a couple things that we talked about last time. This will not take any school time. This is not part of the school. The only thing the schools will be doing, and they have offered, is to send out the invitations to the parents. So there'll be no school time, no teacher time involved either. The student actors, who are volunteers from the community, they would do this on a Saturday, so it wouldn't affect their schools, and it's a one-day project. The cost is, the first part of the cost is $10,000, which is a big number, but that's a one-time thing. What that does is that it enables the organization that puts these on to come up and train us, and covers their expenses and gets our county involved in this project. After that, the royalty fees are $240 per performance. and that may or may not be done by the county. It depends on if the first event is going to be successful, and I believe it will be. It's been done in several other states. We've got letters from sheriffs and police that are praising the system, saying that it has it brings focus to the parents and to the community so they can start to talk about what's going on with the kids. It's I think, a new approach that we should try to, well, it's going to help prevent the youth from getting into big trouble. And it also allows the parents to discuss what's going on with their kids and starts the conversation. With that, I'd open this up to discussion. Anybody has any further questions on it?
So, Kelly, I've been reflecting on this a lot, and particularly when we look at our statistics for Cowlitz County overdoses in the last month of 10. You know, obviously, I think as a public health board, we have to look at the substance abuse in our area and figure out what we can do. We just can't not take some action. My concern with this proposal is that what I would like to see is that we really get together a coalition of the people that are involved, those in the know that know about Cowlitz County, not Ventura, California, but Cowlitz County, and what is going on here. What do our experts in our area say from both the evidence and experience is going to be most beneficial for our area? I'm not convinced that this is going to be most beneficial for our area. And personally, I would rather see the $10,000 put towards putting together a coalition of our local people that could tell us what can we do.
I'll clarify that. The group that comes up here, I believe you have somebody, is there Catherine from Bright Online there? I think we have the person who puts on who is the organizer in California. And what she has told me, and we'll have her, if she can, Kelly can bring her up. Catherine, would you like to speak to that? Can you hear us?
Yes, I can hear you. Can you hear me?
Yes. Can you speak to the how you localize the production?
Yes. Part of what we do, which I agree is very important, what you're talking about. Part of what we'll be doing is coordinating with your county and with your areas about what needs to be included in your reality parties. So definitely that video that you saw was from way back in the beginning when it was mostly alcohol that was the focus. But sorry, my phone is ringing, the timing. I'm back. So part of that will be adapting the script and exploring the issues with people from your county or the specific area where that party is going to be held, so that we're including the things that matter, so that it's not something from Ventura County, that it's what young people and what those who are addressing overdoses are seeing in that area. And also just really, it's the performance itself is brief. What wasn't brought out in the video is that a really important part is after that tour through the party, those parents sit down with people from your county, whether it's counselors, law enforcement, preventionists, to have a discussion, that debrief when we then talk about what can we do and trying to understand things is very, very important part of this. And that really is all about your area. That's part of the training, is how to make sure that it's local and current.
From what I understand as well, the students, when they're getting together for before the performance, they discuss what's going on in our communities. So, for example, meth, vaping, that kind of thing, which is going to be tailored towards our community. And we have worked with a drug counselor here in our area who is also in favor of the program. and who knows a lot about what's going on, particularly, well, solely in our county. You
That's
have a
right.
question? Go ahead, Catherine.
We won't just be showing up on a Saturday and suddenly putting on a performance created by people in Ventura County. So, you know, the youth their main thing will happen all on that Saturday, but we will have some Zoom meetings in advance with them and any others that you want to have contribute to what substances would be at a party in the area we're going to, and those things. So that's part of the whole coordination and training.
And I'd urge the board, since we have Catherine online now, she's the organizer for the group. If any commissioners have any questions financially, or anybody else on the board had a question for her? Okay. Well, thank you for your input there, Catherine.
Thank you.
Question from the public.
Yes, thank you for the opportunity to share some thoughts. First of all, a comment to all of you is your passion towards youth and families related to substance use, misuse. But what I want to talk about, and I work for WSU and 4-H and Family Development here locally. I'm also on 3 coalitions. We have 3 coalitions. We have one in Castle Rock, we have one in Kelso, and we have one in Longview. And the coalitions look at healthy use data, look at where are our gaps, where are our assets too, and then also look at programs that have been effective to reduce substance use among teens. There's also some things that over time has shown to be effective strategies, and then things that are not effective. And so I shared this document with Commissioner Dahl this morning. So this is the highlights. And I don't expect you to read all of it. And then Betsy will have another document to share. Good, you were on a roll here. So, over time, just some highlights is, so what over time, some ineffective strategies are scare tactics or fear-based. I think all of us remember when, the pictures of the meth addicts and they didn't have any teeth. That's a scare. Or this is your brain on drugs. I think I've been around long enough. It's a fried egg. Okay, guys, are you with me? Okay. The other thing is that, we all have either had the opportunity to have kids in our lives, and probably the most challenging age is middle school. From an adolescent development standpoint, they're trying to figure out who they are. Peer group's pretty important. Is that if you think about your own kids, if you just say no, what do? They probably roll their eyes to you, okay? We've all been through that. So the other thing is strategies that focus on, if you smoke, you're going to get lung cancer. Well, for youth, that doesn't make any sense to them unless they probably have had a family member. So those are some ineffective strategies around content.
But just to clarify though, all those strategies you're talking about is geared towards the kids, correct?
Correct.
Yeah, this program is not for the kids.
Oh, hold that thought. Okay. So it's really for the parents. Okay. And so any program needs to have clear objectives and goals and impacts. So as a result of this program, what's going to be the results? Has it proven to be effective? The other piece is that the activities need to be age appropriate. So, is it developmentally appropriate? But what I really wanted to share with you is go to maybe the last page, because I wanted to build upon what you're saying, Kelly, is that what's really important is, one-time events don't work. Assemblies really don't work, sorry. Is what needs to be is family-based strategies. And I think with the lady that was on the Zoom talked about, an opportunity to discuss, the parents to discuss with the kids, or some strategies to help the parents in dealing with this. And I think that's where, in looking at effective programs, they need to be family strength-based activities, skill building within parents. And that's, and in other words, multiple sessions. So because you also need to build, the youth need skills. They need to know how to handle peer pressure, because they talked about peer pressure in the video, is, really intentional training and work with kids on peer pressure or to help the parents. So I guess what I'm trying to say is that when you look at effective prevention strategies, look at these different aspects, and does this program meet that? I think, Kelly, you had shared that you've talked to several people, and I'm glad you're doing your research. And it'd be interesting to know here in Cowlitz County what sheriffs, if Sheriff Thurman has supported this, what the police in the respective jurisdictions. The other piece is that, clarifying no school time, so that, and I think and I've delivered Strengthening Families program for a long time, and I'm not here to ask for funding for Strengthening Families because that money went away, okay, just for the public, but if somebody else wants to do it. But what you find is that oftentimes you put on programs and the parents don't come. And I think the other piece, and I will go back straight to families. One of the things we do teach the teens in Strengthening Families practice peer pressure, how to deal with peer pressure. And they don't practice peer pressure on each other because then they learn how to do it. We use trained adults to role model that. The other piece is some basics, and I think if we all had this little card, is when our kids, when the teens are going to hang out with teens, they're not going to hang out with you guys. Sorry, if you've gone through that piece as a parent, is then you have how do you have set limits, love, consequences, expectations, communications. One of the things that we teach in Strengthening Families is to the adults, and then they practice with their teens is, if a youth wants to say, man, Mom, I want to go visit Josh. And the parent will say, so tell me who Josh is. Where are you going? When are you going to be back? I would like the phone number of Josh's parents, because those are some effective strategies in helping parents deal with what we call, who, what, where, and when. So there's some effective strategies in helping with this. So I just wanted to give you a high level view, and I think the other piece is that, and this is a challenge in the prevention world, is there community readiness? Is there community readiness for this? Is there agency readiness for this? I think those are things you always have to figure out in designing programs that meet the needs of a specific county. So that's my high level conversation. So. And then I think Betsy has another publication she could just share with you, I think, just to hand out. And it's more, I think the reason that we're here is to provide an opportunity for education, because we've been trained in it, and just to help you as community leaders and elected officials, what's the best for Cowlitz County youth and families. So.
Thank you. After the end of the program or the play, there is what Catherine brought up and I have seen is a debriefing session, and that's where police will come and talk to the parents and discuss a number of the points that you just brought up. Please, another public comment?
Well, go ahead.
Oh, go ahead.
Well, following up on the previous one, is that who, what, where, and when? We need to let parents know that it's okay for them to ask those questions. In fact, it's expected of them, but first you start off, it's okay to ask the questions of their kids. Secondly, it's okay for them to show up at one of those parties or gatherings and just show that they are caring parents. Now, there's a lot of action that occurs, and I can testify that when you get home, there's some discussions, but ultimately there's positiveness that comes out of that. If you are a caring community and a caring parent, you do things that show that you're caring and loving. So that's part of it. The second part is we're right on top of it right now. If you read the Longview Daily, is that we've had 10 drug deaths in January in our county. One of those was a teen. So again, there's news, there's information that needs to be out. Are you the next one or whatever? Thirdly, mention the sheriff. I have expectations on my sheriff that's not quite met reality about knowing what the heck the drug traffic is in our community and what he's doing about it in a sanctuary county. So we need to be informed of, one, what he is doing and what he can do, because the drugs don't get there automatically. They have a pathway.
We have a hand up in the, go ahead, Kelly. Oh, go ahead, Catherine.
Oh, okay, thank you. I want to say I absolutely agree with all the things that the last speakers have said, other than they have a misunderstanding about the program and what it's about and how it works. I have been doing prevention in Ventura County for many, many months. And so, I mean, not many months, many years, since 2005. So this is environmental prevention. Like, rather than we don't do school assemblies, we don't do scare tactics. This is about changing the culture and helping parents change the culture around partying and dangerous drinking, for parents to understand and have relevant discussion with their kids and with each other. I see parents pulling out their phones in the debrief and exchanging phone numbers because now they realize we got to be talking to the parents of our kids' friends. This is about sorry, I'm shaking because I am passionate about this, and I feel like it's really misrepresented. It's about parents understanding what social pressure is like. It's not just like, if you don't drink this, I won't be your friend. They get the feeling and understand how the drinking game happens, and why kids that know better, that are doing great and making really great choices in their life, end up doing something that's very dangerous. Understanding it's not just don't drink and don't drive, or you're going to the party to look out your friends. What are really the risks that are happening? It's, for us in our county, it helped get social host ordinances passed throughout our county so that there are consequences. So other cities and other counties might have other specific goals that they have in mind, but that's what this is about. I know that parents don't show up to meetings. I know that parents don't show up to a lot of things, but this is interesting and it has a draw. So, especially in the counties that have had them before, the minute registration opens up, my phone is exploding because I'm seeing that the registrations are coming in, because parents know that they need to get a spot. A wife that goes through it will come up to us afterwards and say, my husband didn't come, but is there a space in a later tour if I could go up and bring him? Because it's much more informative. It's not scare tactics. Kids are not running around acting drunk. It's really helping the parents understand the culture more deeply and understand what parents can do, having the chance to talk to school counselors and others to see what are healthy family policies, what are strategies, how can we be communicating with each other, how do we not allow these things to happen in our community, how do we make it fewer places where kids can do dangerous things. So I absolutely agree with all the points that the preventionist made about what is effective policy, what is effective prevention, and that's what this is designed as. So if anybody wants to at another time also ask me some questions around that, other preventionists, I'd be happy to take emails or phone calls.
Thank you for that. I think it's an extra tool that this county has not tried. Obviously, there's a drug problem in the county, and I think we need to do something new. Please.
Well, I'm just wondering what the harm could be to the county to take this risk of providing this kind of program. And if there's a real downside to it, I'd be concerned, but is there a real downside? Or is it an opportunity to do something that we haven't done yet? Because the data doesn't show that things have gone down consequentially as far as what we've been doing with our drug prevention. And the coalition does a great job. And I don't feel, I'm not trying to say anything negative about what's been currently being done, but this never has been done here. And I'm trying to decide what the downside is except for the cost. If the actors are a concern, we had a good comment about it could be 18-year-olds from the college actors, or something like that. It doesn't have to be, does it have to be high school students? That it does seem to bother parents that they might be the actors in some of these scenes. And so it's just a thought. I was trying to decide the downside of all this. I'm having a hard time figuring that part out. Thank you.
Thank you.
Kelly?
Yes.
Couple things. What the last gentleman that got up and spoke about with the sanctuary counties and things, I think that's a great discussion that probably needs to be taken up at another time as well. I want to first of all thank you for all your time you've put into research this and things. I really do appreciate that. But I do have some concerns. I do have a concern about the impact on the actors. I know, like, I wouldn't ask my girls especially to be part of it, especially in the implied sexual assault that's part of it. I think that would be really rough on them. And if I couldn't ask my own kids to do it, I don't feel like I could ask somebody else's kids to be part of it. I think it's going to take a lot of manpower, and I just question the longevity of being able to get enough people to really do it well. So I do have that concern. And then on a more practical level, I guess, I haven't seen straightforward data that says this is the decrease in drug use that we've seen from this program. I looked through the data that was sent, but I haven't seen anything that just says, here's the before, we had this percentage, here's the after, it's now decreased by this much. So I do question that if that's a good investment of our money. So those are my concerns.
I want to echo a couple things that have been mentioned today. First of all, Kelly, I'd like to commend you on your efforts in this. Coming up with something like this and proposing it to a group of people and opening yourself to criticism and scrutiny takes a lot of courage. Thank you for that. I just looked up the statistics in Ventura County as far as crime rate goes, teen alcohol drinking, that type stuff. And multiple articles state that Ventura County is one of the safest counties in California and that it has the lowest teen death rate in California. Having said all of that, there are still some concerns that I have with the program. The sheriff in Ventura County, we have a letter from him stating that he is in support of that program, and it also says that Ventura County is one of the safest counties in California. So I'm sure that a lot of that has to do with the sheriff and his efforts in that county, and it sounds like it's a very involved community in Ventura County, that they're very involved with the sheriff and law enforcement there. All those things I think play a role. I don't know, I'm not convinced that this program is the end-all, save-all. And if we're going into it with that approach, I think we're going to do it a disservice. It's not an end-all, save-all. I think that it's a first step. My concerns with it are, I don't know, I'm just looking at myself and the things that I've been able to do. I could probably do the exact same thing, throw the same kind of party with the same kids and have a debriefing with parents for less than $500. That's where my issue is. I view I have to ask myself often, what role should we be playing in a lot of these things? And in a situation like this, ultimately what we're trying to do in a roundabout way is legislate morality in decisions. And I don't know that we can do that. If legislating morality worked, we wouldn't have a need for jails. We wouldn't have all the issues that we have in society because people would make moral decisions. And to the point that was made, I think we would be better served coming at this from the approach that these kids, they're having it's an identity crisis is what we have. These kids are going from one shiny thing to the next, looking for acceptance, looking for approval. They're looking for likes on their phones. They're looking for all these things that are going to make them feel accepted, make them feel like they're a part of something bigger. And there's nothing that, those are all hollow Easter bunnies. There's no substance, there's no core to any of that stuff. And as much as I think that this is a good program for parents, there again, we're trying to teach parents that they need to do these things when I quite honestly, I would venture to say that the majority of the parents that would go to these types of things are already the parents that are having these conversations with their children. And I don't know that we would have that, the impact that we're looking for with regards to having a parent type meeting or production. So overall, I think that it is a good program. I'm not necessarily opposed to it. I just don't know that we would be able to achieve what we want to achieve in the long run. Having said that, it is a first step. It is a step in the right direction. I'm a little bit leery about allocating public resources to something that I'm not sure is going to do what we want it to do.
And
Sure.
go ahead.
Boy, there's a whole lot to cover here. First of all, I think if you're looking for an end-all, save-all, you're a dreamer. There's no such thing. And society changes constantly enough that even if you found one today, it's not going to be worth a damn tomorrow. Second, if you don't legislate morality, you have no standards. You wouldn't be putting anybody in jail because you wouldn't have a standard to use to put them there. So yes, you legislate morality. Thou shalt not kill. So you can only do your best, and not to say that that's going to strictly control everybody in the room or everybody in the county, but you have to have something that says that here's where things are acceptable and they're not. The other thing is that strikes me listening to people talking is it seems like there's a dividing line here to me that on one side, there's a desire to have a teaching moment that teaches the risks to parents and using actors, and purely that it is something to teach the risks involved with drinking, with drugs, with whatever you put into that. The other side seems to be painting this as a training session to teach kids how to drink and use drugs and teach parents how to throw drinking parties for their kids and risk jail and risk getting raped if you pass out in a room because you had too much drugs. I don't see this as a training. I see it as a teaching moment. So I don't, and I, looking at a lot of the information here that you handed out, I think this program fits into it very nicely. So I at this point, I would not be opposed to spending money to put something like this together. Because how many programs have been tried and failed? I mean, the way that you figure out if something works or doesn't, sometimes you have to cross the line and say, I will invest in this, and maybe I'm going to lose money, and maybe I'm not. And maybe it'll turn out good. And maybe down the road, it has to be tweaked a little bit here and there to fit our needs. But somewhere, some way, you could kill every program that comes down the road if you're going to say, well, we've got to study it to death before we're going to spend $1 on it. We'll waste our money studying it. So I'm not opposed to this.
I'd just like to add 2 points to that. The money is going to come from the opioid settlement, so it's not a tax increase or anything like that. This is monies that have already been provided, the HHS has. Number one. Number two, after the performance is done, the students come out of character and address the parents directly, and they become advocates for drug prevention.
I would like to thank Commissioner Farrell for his comments because it actually reinforces my point to your example of thou shalt not kill. Our Constitution was founded on faith-based principles.
Absolutely.
And when we come up with programs that are not faith-based, it's very hard to implement that morality. And if you look at the majority of all our laws in the Constitution and the Ten Commandments, those being faith-based principles, people know that it's wrong to kill. And yet people are still on trial for murder every day. So that's my point. I would like to see a program like this implement and come out with openly faith-based principles to teach that morality to the parents so that they have somewhat of a vehicle to teach that to the children. Any program that we come up with that tries to exclude the faith-based principles, openly talking about having faith. I mean, even Narcotics Anonymous, Alcoholics Anonymous, they're talking about turning things over to a higher power. That's my point. I don't know that unless we involve that in these programs that we come up with, and it is the core to these programs, I think we're just going to keep spinning our wheels.
So I, excuse me, very, very much appreciate the discussion. Thank you for this. You already addressed some of my things that I was thinking of. This has been, discussed a lot. I also very much appreciate looking at this from a risk-benefit perspective. And perhaps that might help us as we move forward with the decision and think about what are the risks, what are the benefits. So I just scribbled a couple notes, and by all means, this is not inclusive. So the risk is in spending $10,000. Always a risk when you're spending money, even if it's from opioid funds, so not directly taxpayer money. It also sounds like there's a risk with this with some of the role playing. Okay, how does that affect those that do the role playing, et cetera? I'm sure there's other risks that people would like to share. When I look at benefits, and I have to try to look at this very objectively, one of the benefits is teaching. What you presented talked about strengthening families. Well, I think anytime we open communication in a family, that does do some strengthening. So might be limited, but this is a benefit because it'll strengthen the discussions with the teaching. The other benefit that I see is at least we're doing something. And whether we know it's going to be effective or not, we don't have any way to know yet if this particular proposal is going to help in our area. Maybe it is going to have a benefit. Maybe it's going to have a downside that we don't know. And so I open it up to looking at this from a risk-benefit perspective. Thank you.
I'll weigh in a couple comments here. Number one, I'll echo Commissioner Rader a little bit. I think any program, there's 163 tenets in the Bible that tell you how to act. Of course, we always refer to the 10 commandments, and the two most important, of course, are love your God and love your neighbor. But I think he's exactly right that faith has to be part of this. And I have gone over this before. We had another discussion at one point in time. I've had on to it. There's a couple studies that kind of back this up. Deaths of Despair in Church. This is done in May 6, 2020 by Harvard School of Public Health. And it focused on suicide, drug overdose, alcohol poisoning. It involved over 66,000 women and over 43,000 men. And the simple act of attendance once a week in a church produced 68% lower risk for women of suicide, drug overdose, alcohol poisoning, 33% lower risk for men in the same categories. Florida State University in May 2018 worked on teens. Teams engaged in church, 5 times less likely to binge on alcohol, 8 times less likely to use marijuana. So and then there was another study that was Institute for Family Studies. This was September 2019, similar results. So there's some stuff there's been some work that's been done on this. So I think whatever we do, I think we have to try to bring some of that in, because when I'm looking at this stuff, it produces results. So the other thing I would say is, we've beat this for enough months. I think we need to decide whether you want to send it to the commissioners to further it, or you want to decline it and let's be done with it. One way or the other, would be my suggestion to you.
I like that. And I'd also say that because we're able to start this, we can add God into it, because I believe that you're absolutely right. It is a moral-based kind of a thing that we need, and that's not being taught in schools today. So I think that that's something that we can add to it. So with that, I'd like to make a motion that we move forward with this project, a reality party, and pass it on to the commissioners for funding. So that's my motion, is to move forward with the reality party and start with the $10,000 starting point, to be determined when it will be performed and upon commissioner approval. So with that, further discussion? Anybody on the board? Comment?
So, I have another colored handout for you, but I think, and I appreciate the comments, and that from my experience of delivering programs is, make sure that if you choose to go this way, is don't just do it 1 year and then we're done, because then you're not going to see if it's been effective. I think at least, because I've been part of other grants, like a 3-year grant. Well, by the time you get it figured out, the grant's done. So what's more ideal is at least 5 or 6 years, so that you have that opportunity to see if it's going to work, and it becomes the norm of Cowlitz County that, we're going to have this program. And I think that would be my one really plea, is don't do the one and done. So it's sustainable funding for a while.
I would agree with you on that. If we make the commitment, you have to give it enough time so you can track and see if it's doing something. So, yeah.
Gina?
Thank you. I just had a quick question about if there was discussion about who would lead the effort.
I don't think we've obviously talked about that, but I do believe that forming a community coalition with people that are involved in that type of stuff that goes on in our community is important, and having and giving them the opportunity to continue the program on if it comes to fruition.
It approves, yeah.
I would agree totally, and I think some of that direction I would expect would come when the commissioners bring this up, if it gets forwarded to the commissioners.
Well, what I want to say is that this looks like you're just opening up another can of worms, and especially just what Gina's saying, who's going to run the thing and all that. Sounds like we have people here that have a lot of experience in our county doing this kind of similar programs I don't know exactly what. Why are we going way the heck out of town when we got people right here doing it? Why? It makes no sense. And you're gonna spend 10 grand like this and then, but that's not gonna be the last of it. You're gonna keep doing it. We got people right here that are already doing it.
I was going to follow up. The risk reward is that spending $10,000 is, anyone would look at it. If you save 1 or 5 events in the county, it's a dang good investment, no matter what. The other, though, as Gina and we were pointing out, it's a teaching and a learning experience, et cetera. So you've got a model, you've got a script, you've got some things to challenge against. I would challenge our community to come up with their own play following a model and a script. We've got the churches, we've got the schools, we've got the acting groups, et cetera, and say, hey, put a script together, get people involved in it, and even have a challenge or whatever. That's a heck of a good way to get a lot of traction. Or maybe you don't get any traction. I don't know. I would hope we would get a bunch of traction in the community, from the faith communities, and say, let's get engaged.
And I would like to include that's a great idea, and I've already thought about doing that with my church, talking to our pastors. They can provide some of the leadership as well as some of the groups that are already doing stuff. We'd like to have you on board. So any further comments? Hands up. Okay, with that, let's put it to a vote. All in favor of proceeding with this reality party, in favor, say aye.
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 Aye. Any opposed?
Nay.
So we have 4 for it and 2 against. Motion passes. Thank you very much for all your time and your listening to this, and let's hope it works, and I think it will. So with that, because of time constraints, I'm going to table the last item of business till the next meeting, and if anybody has any further comments or questions, without that, we'll go ahead and close this meeting, adjourn the meeting at 11:22. Thank you very much for coming.